Hello, welcome to Trillium House. Come on in. The setup confuses a lot of people because Trillium is one entity. Trillium House is a space, and then there are all these providers who have separate businesses that work inside of Trillium House. So when you go to the Trillium House website, people will see faces of several different midwives, and if you look closely, they have different business names listed next to them because Trillium is like a home to all of us, even though we're in separate practices. And because we work here, we do share a lot of values. So anybody that you pick off of that website is going to be a really good option. Each midwife practices a little bit differently, and they have a little bit different cutoffs. Our base philosophy is the same, but we're all looking for somebody who's really motivated toward like self-initiation, and like they want to be involved in the process. They want responsibility and agency in their care. So if you're somebody that doesn't like to do research and just wants things spoon-fed to you, you're probably not going to pick Trillium House, because we're going to constantly say, here's some information, you know, might be on the vitamin K shot. All right, vitamin K shot, this is state mandated and this is the medical standard of care, but lots of people have questions about this. Here's evidence on this side, here's evidence on this side. Would you go home and look over this and then tell us what you feel comfortable with? Tell us what your questions are. And then we want to have a conversation about that and choose what you feel good about. Or maybe it's something that's less like controversial, so to speak, and we're saying, what are your nutrition goals? And maybe you don't have any, and that's fine. You don't have to be like, you don't have to come to this with a whole bunch of knowledge or education on a topic, but it's that desire that you want to really work with your body, listen to your body and the cues that your body and your baby are giving you to give yourself and your baby the best shot at this physiologic birth. We can only serve moms who want natural birth. We can't do pharmacological pain management outside of the hospital. So epidurals and you know, the IV medicines like fentanyl or Demerol. We don't even have nitrous oxide right now, as far as I'm aware. I don't think any of the community providers are offering that. That does not mean that a mom has to be 100% certain that she can do it without that to give birth outside of hospital, right? That just has to be her desire, right? And when we have moms who come into care and they're giving birth and something doesn't go quite right, or maybe it's just really long and they've been awake for 3 days and they need an epidural, that is not an emergency. That's not a big deal. We're gonna resource that client and get her into the hospital care that she needs. We go with moms in that situation. So that's a question I hear a lot of, like, but what if I do need an epidural? And I'm like, that's easy. Then we just take you to the hospital. And that's not an emergency and that's not a failure, but somebody who wants that should plan to birth in the hospital. Some midwives do offer prenatal care for moms who do want to birth in the hospital. So maybe you love the idea of everything you hear about community midwifery care or Trillium House providers, but you still you're like, but for whatever reason, maybe I just feel more comfortable in the hospital, or I really do want this tool that they have and the community midwives don't. You had that option to have prenatal care here in the community setting at Trillium with some of the providers. Again, not everybody offers this. I offer this, and there might be others who do. And so that's another way that we can help serve everybody, even though, you know, that person doesn't have to commit to birthing out of hospital.